This is a presentation by Dr. Andrés Ursa titled Non-pharmacological Approach to Degenerative Neuropsychiatric Disorders for a congress held in Vienna, Austria on the 8th and 9th of November 2021. Discover new technologies to promote the treatment of neurological complications. Dr. Ursa's CV, he is a Doctor of Medicine and Surgery from Madrid Complutense University. He is a teaching official in the healthcare area of the regional government of Castilla y León. He is a director of the Naturist Clinic and Institute of Integrative Medicine in Valladolid, Spain. He is a member of the Ramón y Cajal Illustrious Academy of Health Sciences. He is a winner of the Dr. Gómez Ulla Award for Health Excellence, and he performs a care, teaching, and research activity. Table of contents includes introduction, medicine focused on therapeutics, mental health, gut microbiota and brain development, organ function of the gut microbiome, the gut-brain microbiome gut-brain axis, neuroinflammation, relationship between the gut microbiota and neuropsychiatric disorders, neurotransmitters and the gut, role of short-chain fatty acids, gut microbiota and Alzheimer's disease, gut microbiota and Parkinson's disease, gut microbiota and depression, gut microbiota and psychosis, gut microbiota and psychotropics, how to obtain a healthy gut microbiota, cognitive neuroscience and health, summary and conclusions. Introduction. The different studies that have been performed over the last few years have found that people with psychiatric disorders frequently have dysbiosis. Neurodegenerative diseases, NDD, such as Alzheimer's, Parkinson's, multiple sclerosis, etc., of unknown etiology, pose a huge concern due to the suffering it entails for the patient and the family, the impotence of doctors to be able to satisfactorily address its course due to the economic cost it entails for the family and healthcare systems. Faced with the growing avalanche of NDD, governments have to provide financial and human resources to public health and social and health services with the risk of collapse of the healthcare systems of developed countries. As the cause of NDD is unknown, preventive measures involve adopting a healthy lifestyle with foods that do not promote inflammation, physical exercise, learning stress neutralization techniques, proper management of emotions, etc. The climate change in which we are immersed will undoubtedly be the greatest challenge humanity will have to face. The current SARS-CoV-2 pandemic is possibly only the beginning of what may come. Healthcare professionals, in addition to medical, scientific, technical knowledge, will need additional preparation to be able to tackle the consequences of climate change. Medicine focused on therapeutics. In recent decades, professional care in the area of neuroscience has focused primarily on people who have suffered or suffer from any type of brain damage or neurological impairment. This is mainly due to the exponential increase in survival rates thanks to greater medical and neuropsychological knowledge of the consequences of damage, as well as creation of increasingly advanced diagnostic methods and treatments. Medicine focused on mental health. The gut microbiota can influence mental health as it connects the gut, emotions, and behavioral responses in the well-known microbiota gut-brain axis. This should encourage medical professionals to reorient diagnosis and treatment of a multitude of neurological diseases and disorders, also from the microbiota with probiotics, prebiotics, and psychobiotics. Gut microbiota and brain development. During neurodevelopment, the brain is sensitive to signals originating from the intestinal microbiota, and it has been shown that infections caused by microorganisms during this period generates neurological disorders such as autism and schizophrenia. Exposure to antibiotics early in life could alter the development of the human brain in areas responsible for cognitive and emotional functions. Organ function of the gut microbiome. The intestinal microbiota can be seen as a metabolic organ, totally attuned to physiology that performs functions man has not necessarily had to develop, acting in a symbiotic way. An image of the gut-brain axis. The gut-brain axis concept emerged in the 19th and early 20th centuries based on observations made by Beaumont, Darwin, and Cannon, along with Pavlov studies. The microbiota gut-brain axis encompasses the central nervous system, CNS, the sympathetic and parasympathetic branches of the autonomic nervous system, the enteric nervous system, and the neuroendocrine and neuroimmune systems. The communication pathways between the gut and brain include the vagus nerve, the immune system, short-chain fatty acids, and tryptophan. Brain communication occurs through the extrinsic sympathetic nervous system of the intestine, bacteria or their metabolites, which in turn influences intestinal physiology. Discovery of the modulation circuit of extrinsic neurons by the microbiota or its metabolites could lead to the development of new therapeutic strategies for regulation of intestinal motility, visceral pain, enteric immunity, and metabolic disorders. Role of the 10th cranial nerve. The vagus nerve is the longest of the cranial nerves and contains both motor and sensory fibers. Its activity enhances personal reinforcement, conditions preferences, and induces the release of dopamine, a neurotransmitter that determines behavior and cognition, motivation and reward, the regulation of sleep, mood, attention, and learning. The intestine and substances generated by its microbiota are therefore, by means of the vagus nerve, important regulators of mood, motivation, and reward. Neuroinflammation. Research on the gut microbiome and brain behavior through a number of pathways such as alterations in gut permeability and consequently neuroinflammation is supported by evidence linking stress to both gut barrier function and the impact on the expression of neuropsychiatric symptoms. By means of its interaction with the immune system, stress can increase the levels of pro-inflammatory cytokines such as tumor necrosis factor TNF-alpha, interleukin IL-1 beta, and IL-6 and IL-2R. Mechanisms of neuroinflammation production. Passive diffusion across the blood-brain barrier after intense immune activity. Active transport of inflammatory mediators through the blood-brain barrier. Release of glial cell activators by the vascular endothelium. Activation mediated by the vagus nerve. Causes and symptoms of neuroinflammation. It is suspected to be related to alcohol intake, Western-type diet rich in meat, fats, gluten, and refined carbohydrates, poor in dietary fiber, insufficient rest, few hours of sleep, non-restorative sleep, etc., chronic stress, and a deficit in physical exercise. Clinical factors are mental fog, confusion, lethargy, and apathy. Low-grade chronic inflammation and neuroinflammation. Low-grade chronic inflammation can lead to changes in brain structure and synaptic plasticity that lead to neurodegeneration. Neuronal repair due to increased glucocorticoid levels may be the initial markers of depression as well as a prelude to dementia in older people. Therapeutic intervention in neuroinflammation. Stress-induced changes in the hypothalamic pituitary adrenal axis and the autonomic nervous system are sensitive to intervention of the probiotics Lactobacillus helveticus and Bifidobacterium longum. Relationship between gut microbiota and neuropsychiatric disorders. The relationship between microbiota and host is established by different pathways such as hormonal mediators, neuronal activation, or microenvironment signals, which can affect the development of various diseases. This makes it the current target of research whose results would propose new therapeutic perspectives. Intestinal dysbiosis and the nervous system. Intestinal permeability, bacterial overgrowth, or dysbiosis cause toxins generated in the intestine via the vagus nerve to go retrograde to the nervous system. There are also some other toxins released into the blood and from the blood cross the blood-brain barrier and enter the nervous system, which modulates the brain's development, function, and behavior. Pathophysiology. Situations such as stress or taking certain drugs, such as antibiotics, have harmful effects on the intestinal microbiota. They block normal communication of the microbiota brain-intestine axis. This alteration is related to cognitive disorders, autism, attention deficit, and hyperactivity disorder, etc., and neurological, psychological, and psychiatric disorders. It is also linked to gastrointestinal disorders such as irritable bowel and inflammatory bowel disease. Intestinal permeability. Lipopolysaccharides, LPS, a virulence factor produced by bacteria, are a toxin that can cause low-grade systemic inflammation through the circulation. Low levels of LPS, known as endotoxemia, cause inflammation and are commonly associated with obesity, which predicts an increased risk of diabetes and cardiovascular disease. Neurotransmitters and the gut. Several investigations have revealed that bacteria such as lactobacilli or bifidobacteria are capable of synthesizing neurotransmitters such as GABA, acetylcholine, or serotonin involved in depression and anxiety. Correcting the lack or scarcity of these bacteria would help improve symptoms. The advantage of probiotics is the scarcity of side effects. Role of short-term fatty acids, SCFA. Gut bacterial metabolites have a substantial influence on regulation of the gut-brain axis and local and systemic immunity, SCFAs, produced by bacterial fermentation of dietary carbohydrates with immunomodulatory properties. SCFAs can interact with nerve cells by stimulating the sympathetic and autonomic nervous system by means of G protein coupled receptor 41, GPR41, and GPR43. Microglial homeostasis and SCFA. SCFA derived from the intestinal microbiota regulate microglial homeostasis, which is necessary for proper brain development and brain tissue homeostasis. SCFAs can cross the blood-brain barrier, modulate brain development and behavior, and are implicated in the development of autism spectrum disorders. SCFAs also regulate release of intestinal peptides from enteroendocrine cells, which in turn affect gut-brain hormonal communication. SCFAs have recently been shown to regulate gut-derived 5-HT synthesis from enteroendocrine cells. Gut microbiota and Alzheimer's disease. Several studies have demonstrated the presence of intestinal dysbiosis in patients with Alzheimer's disease, as well as involvement of the microbiota in the brain accumulation of B-amyloid protein associated with the disease. Amyloid deposits were measured by positron emission tomography, PET, and quantified in different areas of the brain, while blood concentrations of molecules derived from the intestinal microbiota, lipopolysaccharides, LPS, and chain fatty acids were determined, short acetate, propionate, valerate, and butyrate, pro- and anti-inflammatory markers, including interleukins, and endothelial dysfunction markers, cell adhesion molecules, or MAC. Discussion. Regardless of the brain area affected, a positive correlation was observed between amyloid deposits and the blood concentration of LPS, acetate, valerate, certain pro-inflammatory cytokines, IL-1B, IL-6, among others, and numerous MACs, P-selectin, PECAM1. However, a negative correlation was detected with the concentration of butyrate and IL-10, which is anti-inflammatory. Some biomarkers of endothelial dysfunction showed a positive correlation with the concentration of acetate, valerate, IL-1B, and IL-4, but again negative with the concentration of butyrate and IL-10. The authors interpret these correlations as evidence of a direct and indirect implication of blood parameters associated with intestinal dysbiosis in amyloid disease. Interpretation. The reduction in the concentration of butyrate accompanied by an increased concentration of acetate, valerate, and LPS could compromise the integrity of the intestinal barrier, cause and maintain systemic inflammation of low intensity, alter the blood-brain barrier, and finally enable penetration of the intestinal barrier of central nervous system pro-inflammatory compounds that facilitate the pathological cascade of Alzheimer's disease. Conclusion. The intestinal microbiota plays a role in the amyloid disorder associated with Alzheimer's disease, which involves bacterial compounds capable of affecting the brain after a systemic inflammatory reaction. Hypothesis. There is the possibility of developing prevention strategies based on an enrichment of the microbiota with beneficial bacteria or metabolites once the characteristic microbial profile of Alzheimer's disease has been defined. Intestinal amyloid deposits. Amyloid deposits related to movement problems are found not only in the brain but also in neurons in the intestine. An analysis of these proteins revealed that those in the intestine were older, pointing out the possibility that the disease originated there and would also account for the reason for many gastrointestinal symptoms related to this pathology. The study concludes that Alzheimer's disease begins in the intestine and not in the brain. Gut microbiota and Parkinson's disease. Dysbiosis, that is a defect in the composition of the microbiota, has been revealed in patients with Parkinson's disease. Fewer anti-inflammatory bacteria and more pro-inflammatory bacteria are presented than healthy people. Treatment aims to limit the motor symptoms of the disease, tremors, stiffness, etc., through the use of dopamine precursors. These treatments cannot stop disease course and complications reappear after 5 to 10 years of treatment. Conclusion. The current challenge is to detect the disease as early as possible and slow down the degeneration of neurons. Acting on the microbiota has been studied. Multiple sclerosis. An intestinal microbiota transplant from an individual with MS to mice causes autoimmune neurodegeneration, which confirms the role of the intestinal flora in this disease. Psychic depression. The microbiota gut-brain axis works bidirectionally in the regulation of depressive behaviors. Patients who have a major depressive disorder show alterations in immunological markers, including an increased activity of pro-inflammatory cytokines, changes in behavior caused by increased stress levels, caspase-1 inactivation leading to decreased inflammasome function, or drug treatment result in changes in the gut microbiome. Diagram of the immunology of intestinal mucous membrane and the effect of probiotics. Role of chronic stress in depression. Chronic stress can exacerbate the release of pro-inflammatory cytokines and thus precipitate depressive episodes. Gut microbiota and psychosis. Brain-derived neurotrophic factor, BDNF, expression plays a role in the molecular mechanism underlying impaired cognition. BDNF, through its influence on brain plasticity, may contribute to the N-methyl-D-aspartate receptor dysfunction seen in schizophrenia. Gut microbiota and psychotropics. The gut microbiota has been implicated in lowering metabolism of psychotropic medications, including clonazepam, risperidone, and levodopa. The gut microbiome can influence the gene expression of liver enzymes that aid in the metabolism and detoxification of drugs outside the gut. Gut microbiota and olazapine. Olazapine, an atypical antipsychotic, affects composition of the microbiota in rats, in addition to triggering inflammatory effects and weight gain. Co-administration of antibiotics attenuates these physiological effects. Antipsychotics and cardiovascular disease. The impact of atypical antipsychotics on the gut microbiota may account to some extent for the increased levels of heart and metabolic disease in patients receiving these drugs. How to obtain a healthy microbiota. A healthy microbiota depends on intestinal health and on having a healthy diet rich in fiber, without excess carbohydrates, with healthy fats from vegetables such as coconut oil or avocado, consumption of organic and proximity products. It must provide levels of functionally active B vitamins such that this enables synthesis of neurotransmitters. Cognitive neuroscience and health. People who practice meditation based on mental silence have more gray matter, which can contribute to maintenance of cognitive functions. Meditators had on average 7% more gray matter in the entire brain. Of all the brain areas, the gray matter difference was most marked in the right temporal lobe, an area associated with emotions, and in both frontal lobes, areas associated with cognitive and emotional self-control functions. Summary and conclusions. The loss of brain mass is inherent to the human being. This loss of brain mass is accompanied by impaired cognition and/or impaired motor functions. Many factors influence cognitive decline, some known, others unknown. Intervention on the intestinal microbiota through a nutrient-balanced diet with sustainably grown food, together with stress control, represents a barrier to neuroinflammation. In the coming years, efforts will have to focus on future research on the gut-brain axis for preventive and curative purposes.